who just don't realize that they can take control of their life. They go to the doctor with symptoms, and the doctor writes a prescription, spends 3 minutes with them, and sends them out of the office, and they don't get better. And because they're not being empowered. And that's why I give people my manual, why I educate people. Because how do you know how to take care of yourself? It's like taking your car. I mean, you don't know how to fix your car, right? So you have to go to someone who's going to teach you how to fix your car, or else fix it for you. Well, doctors don't have time to fix it for you, so you have to get some education so you can take care of yourself. And the more we know and the more information that's out there, the harder and harder it gets. One of the most amazing things I'm doing is all this new genetic information.
Let's talk about your testing, because you're big on testing. You told me on the phone, I get better results now than I did 10 years ago because of the tailor-made way you're doing things. I'm paraphrasing a little bit. But let's talk about some of these testing.
I'll give you an example.
And how it affects results.
I'll give you a great example. I do this test. It's from this lab called HDL. A lot of the information, it's cholesterol testing. And a lot of the information on the test is genetic information. And I have patients who come in and they're on cholesterol medications. And I look at their cholesterol medications and I look at their test results and I go, you know something? The way you metabolize cholesterol, this drug won't help you. And they've been on the drug for 20 years. So they're taking a drug for 20 years with all the side effects. That is the wrong drug for them.
But it does lower their cholesterol.
But it doesn't lower their risk factors. And I have patients who are taking cholesterol lowering drugs who still have to go in and get stents and bypass and balloon angioplasties and all that kind of stuff, and they're on all the drugs. It's because they're on the wrong drug. It's not the doctor's fault. They're just not doing the
Okay, so you see
testing.
these tests, and what do? Are you able to, have you ever had people you're able to take off statins?
I take men and women off of medications all the time. It's actually one of my goals for my patients. I classify myself as being non-pharmaceutical medicine. So I like to enroll the body into its own healing. Teach the body how to heal itself. Put back what the body needs. And one of the things about pharmaceuticals, and we are a pharmaceutically oriented society, unfortunately, is the more pharmaceuticals you put into the body, the more you introduce toxicity. Because the body has to handle those drugs. Those are not natural drugs. So you're putting another stress on the body. And everything in medicine is risk versus benefit. Everything has a risk. Do you know that pharmaceutical deaths in hospitals is the 4th leading cause of death in the country? Did you know that?
No.
It kills people after heart, cancer, and stroke is drugs.